Hi, I'm Dr. Andrei Shustov from University of Washington. I'm a medical oncologist with expertise in lymphomas. The focus of my clinical practice and my research are a rare and diverse group of lymphomas called peripheral T-cell lymphomas, or PTCLs, or simply T-cell lymphomas. They're very rare, there are a lot of them, and it's very hard to navigate when you're diagnosed with a particular subtype. Treating thousands of patients with lymphomas and counseling their families, I learned that the best way for me to take care of my patients is to empower them with decision-making capacity so they're part of the medical team, part of their decision-making. You cannot make decisions unless you are knowledgeable about your lymphoma, about where it comes from, about its origins. So in the first part of our presentation today, I will show you where lymphomas come from, what they are, their nature. And to better understand this, we will start with the immune system. Lymphomas are tumors of the immune system. They are not blood cancers, they are not bone marrow cancers as frequently portrayed, they are tumors of the immune system. You can also call them tumors or cancers of lymph glands, tumors of lymphocytes, or simply, again, tumors of the immune system. Immune system consists of hundreds and hundreds of lymph nodes that are spread out in our body literally from head to toe. These little glands are the ones that harbor the majority of our immune cells. It is understandable now why a lot of lymph nodes are congregated in the areas where infection can enter human body. And think about it, where do we encounter bacteria, viruses, and other infections? The air that we breathe is not sterile. With every breath we take, a lot of bacteria and viruses enter our lungs. That is why a lot of lymph nodes are centered around the bronchi or windpipes or inside the lungs so they can protect us from infection coming in. Think about the food we eat. Food is not sterile, but that's okay because there are a lot of lymph nodes, a lot of immune cells that are congregated around the intestines. Every time the infectious agent tries to enter our body through intestinal wall, immune cells are there. Throughout our life, we move around, and the most vulnerable parts of our body that get injured are our limbs, our arms, legs, hands, and feet. So infections of the limbs are very common. That is why a lot of lymph nodes are also centered around the areas where infection can enter our body through our nail beds, fingers, or toes, namely around the groin area and the armpits, or we like to call it axilla. These lymph nodes are all connected by little tubes. We call them lymphatic ducts. Why they're connected? Because immune cells like to travel from lymph node to lymph node to lymph node. Why do they do that? Because they are surveilling our body. They're looking for infection every day from the moment we're born until we die. If you step on a nail, immune cells need to be there. If you cut your finger, immune cells need to be there. If you have infection in the tooth, immune cells need to be there. How they do that? They travel. So they use this tubing system between the lymph nodes first to educate each other what's going on, sound the alarm, but also rapidly rush to the site where infection can be brewing. That's not the only way immune cells travel. They use the blood system. They hop in the bloodstream, and it's a highway. They can get from one part of the body to the next part within a split second, so they can move very quickly. And that is why, by the way, they're frequently confused with blood cancers. Just because immune cells travel through the blood, it does not mean that lymphomas are blood cancers. It's worth to mention that there are a couple other immune organs that play a major part in fighting infection. One of them is spleen, and you can think of a spleen as a huge lymph node in our body. It has some other functions, but for the sake of lymphoma discussion, spleen is a huge lymph node. The other organ that's worth mentioning is the thymus. And you can think about the thymus, this little gland that sits in the top of the heart, as a high school for immune cells. Literally, some of the immune cells go to the thymus, they get educated, and once they come out, they populate the lymph nodes, and they do what they do. They fight infection every day. You might also ask what happens if infection is under the skin somewhere, inside your eye, in the stomach, there are no lymph nodes there. No worries, the same immune cells can exit the lymph nodes, it can crawl throughout tissues anywhere where infection can enter. Why is it important to understand? It is important because there are so many types of lymphomas, and lymphomas can originate anywhere. It is now understandable that if the transformation into cancer happens in a lymph node in the groin, the cancer can start there. If lymphomas originate in this area, they can start growing in the armpit. If they originate in the lung area, that's where the process starts. There is no particular area in our body that lymphomas come from. They can originate anywhere. As a matter of fact, when it starts from the cells that are traveling outside the lymph node, it can actually grow anywhere in any tissue like liver and lung and brain and skin. We call them extranodal lymphomas. So to summarize, our immune system, the major part of it, consists of a lot of lymph nodes that are spread out throughout human body. They're all connected, and they contain immune cells that fight infection every day. Let's take a closer look what happens inside the lymph node. If you take the lymph node out, slice it up, put it in a microscope, it consists of thousands and thousands of cells, and majority of them are immune cells. We call them lymphocytes. And these are the cells that give origin to lymphomas. Lymph node has tubings that come in and bring the immune cells. It has tubings that come out that immune cells use when they leave the lymph node and go to their neighbors to tell them that infection is brewing somewhere. That also gives you the idea how lymphomas spread. They go from lymph node to lymph node to lymph node, and sometimes they jump in the blood and they can pop up very far away from where they started. What else happens in a lymph node? There are different types of cells, and when bacteria virus enter the human body, the immune cells have to educate each other how to fight it. Literally, they mingle. They use chemical signals that scientists, physicians call cytokines to sound the alarm and pass this information from cell to cell. That starts the immune response. If you start figuring out what type of cells live in a lymph node and apply special stains and special chemical tests, you will find out there are two types of cells. There are B cells and there are T cells. And there is a particular reason why we call them that. T cells have the main function of regulating the immune response. They sound the alarm, they recruit other cells to help them out, to recruit other cells, and I frequently call them the government of the immune system. In a matter of fact, the cells called CD4 positive helper cells are the ones that regulate the whole thing. That's all they do. They also remember the information about the infection. Hence, we do vaccinations. Some types of T cells, also armed with special weapons, they can attack the virus-infected cells. They can attack cancer cells when cancer cells arise in our body. They're called cytotoxic T cells. As a matter of fact, many of you have heard about this very exciting new technology called CAR T cells. We use cytotoxic T cells for that to fight other cancers. A very specific type of immune cells called natural killer cells or NK cells. They have very particular function in the immune system, but they participate in fighting cancer cells, fighting parasites, fighting other infections, and all in all, they are all under the umbrella, again, of so-called T cells. B cells, you can think of as a cavalry of the immune system. They become producers or manufacturers of these little bullets, well, let's call them rockets, called antibodies. Antibodies are huge molecules that B cells produce when infection consumes our body, and these rockets attack the infection and make it go away and make it die off. In order for them to do that, they need the help from T cells. And again, some of them become memory cells so can remember that information. The reason I'm teaching you about this is to introduce the concept that lymphomas are very diverse. This is the very simplistic representation of immune cells. CD4 cells can be further subdivided into several subtypes. CD8 cells can be subdivided in multiple subtypes, so with B cells. And that is now clear why our most recent classification recognizes over 50 different types of lymphomas. I'll let you process that. 50 different types of lymphomas. Because the cell behave differently, have different chemistries, lymphomas are very different. And we are learning over the past decades that we have to treat certain lymphomas very uniquely, very differently from other lymphomas. Why? Because they come from different types of immune cells. On this slide, it is even easier to understand where lymphomas come from. Now that we know the basics of the immune system, we know what types of cells the immune system contains, I will introduce the concept how they develop. Immune cells originate or come from the organ called the bone marrow. And bone marrow is present in every single bone in the human body. It produces all our blood cells, it has a lot of other functions, but one of the most important things that bone marrow does, it also gives origin to our immune cells. When immune cells are born in the marrow, they're still not very educated. They have to go to special places so they can learn how to recognize infection, how to fight it, how to talk to each other. B cells and T cells go to different places. T cells go to the organ I already mentioned, we learned about, called thymus. And thymus is located right in the middle of the chest, close to the chest bone. It sits right on your heart. And by the way, that's why we call them T cells, because they are educated in the thymus. When T cells go in the thymus, they undergo several stages of education. And after they come out, they become competent T cells, those CD4s and CD8s and NK cells capable of fighting infection for the rest of your life. B cells have a different place where they go, and actually scientists still debate where B cells get educated, but we think that the most likely place is our intestines. After B cells go to their school, T cells go to their school, they become what we call immunocompetent cells. They're ready to fight, they're ready to function. Where do they go? They go to the lymph nodes. And that's where they reside for the rest of their life. That's why lymph nodes with the tubings and the spleen, the whole lymphatic system is the basis of the immune system. At any stage of B cell and T cell development, mistakes can happen. Just like with cells in our lungs, prostate, breast, and colon, those cells can make a mistake and mutate. What happens when they mutate? They can become cancerous. That is why lymphomas, and leukemias for that matter, can happen at any stage of lymphocyte immune cell development. And once again, that's another reason why there are so many lymphomas out there. If mistakes happen in the thymus, it leads to development of a very special type of T cell lymphoma called lymphoblastic T cell lymphoma. If mistakes happen after B or T cells populate the lymph node, a lot of things can go wrong. Once they're in the lymph node and it starts mingling, it produces a large number of subtypes of B and T cells. And every one of these processes can go wrong. And that's why it can give origin to so many types of lymphomas. Once again, there are over 50 different types we now recognize, and scientists go through those with a very close look, and probably in the next decade or so, the number of lymphomas is going to be even larger. This is the basics of the immune system and where T and B cell come from. It is now understandable why we have so many lymphomas, why they're so unique. So to summarize what we learned about the immune system is, one, the basics of the immune system are the lymph nodes connected by little tubes. Inside the lymph nodes, we have B cells and T cells. They have different functions, and they can be subdivided into many different subtypes. Lymphomas can originate in every stage of the development. That's why there are so many of them. Because lymph nodes are spread so widely throughout our body, there are so many places lymphomas can start. It is not unusual to have lymphomas start in the groin, in the lung, around the liver, or even outside lymphatic system anywhere in the human body. Because their biology is so different, we have to treat them differently. And science, clinical science, and basic science is finally catching up, determining which treatment is best for every particular lymphoma. This concludes our initial presentation. Thank you for watching. Hopefully, This was helpful knowledge that will lead us to a next discussion on how to manage and how to conquer lymphomas.